Okay, so I hope you all have seen the introduction video of psychiatry. I hope you all have seen the introduction video of psychiatry. So here we are with the first teaching video, chapter number 1. General psychiatry. In general psychiatry, we are supposed to discuss approach to a patient. What do you mean by approach to a patient? How to make a psychiatric diagnosis. In medical school, we are taught that in order to make any diagnosis, we are supposed to take history from the patient, do some examination, get some investigation done, and finally arrive at a diagnosis. What is most important in diagnosis in medicine? In medicine, if I talk, the most important is investigation, but in psychiatry, the most important in diagnosis is history. This is an exam question. Any exam question, I will be marking it in red color ink. If you have colored pens, kindly use them. Or you can pause this video and arrange the colored pens when you are making notes. It's better to make colored pen. DNB, Diplomat of National Board, a separate exam that was conducted previously, now not conducted. But this exam questions many times come. The question was most important in psychiatric diagnosis is history. Because we don't have investigation in psychiatry. We don't have a blood test for schizophrenia, CT scan for depression. Your MRI says you have OCD. So the most important thing in psychiatry is history taking. And history taking in psychiatry is very similar to history taking of any other subject. Like in other subjects also you follow a format. You might have read about history taking format from any subject. Like what is the first thing you ask? Name, age, sex, identifying data. Then why has the patient come to you? Chief complaint. Then elaboration of the chief complaint called HOPI. Then past history. Has the patient had similar complaints in the past? Then family history. History of similar complaints in the family members. Then comes personal history. On personal history, a question came in AIMS exam. So let's write the headings. Identifying data. Chief complaints. Past history. Personal history. These are the main things in history taking. Identifying data means name, age, sex, where is the patient from, address. Chief complaint, which is the patient present. HOPI, I hope you know what is HOPI, history of present illness. Past history. Please remember, past history must be asked only in episodic disorders, never in continuous disorders. That means past history is important in disorder that touch the baseline, not the disorder that are continuous. Like there's no past history in dementia and schizophrenia, but there's a past history in bipolar disorder, mania, depression. Because the disease that touches the baseline, there's a past history. The disease that does not touch the baseline, there's no past history. Okay, in family history, there's very important to ask history of suicide in any of the family members. It tells us was there any evidence of depression in the family members. But more than past history and family history, a question came in AIMS 2016. The question was, psychiatric personal history includes all except, and the options were food preferences, academic history, occupational history, and marital history. Have a look at the question. Psychiatric personal history includes all except. What is the examiner asking us? What is the examiner asking us? What we are going to ask or what we are not going to ask? What we are not going to ask. So if you can tell me the importance of the other histories present in the question, we can come to the answer. Is marital history important? Yes, no. Yes, it is. Why did you say so? Psychiatric illness are more common in married or unmarried? Unmarried. Who told you this? How do you know this? This was your personal opinion about marriage, which was absolutely wrong. Psychiatric illness is equally common in married and unmarried. Marriage has nothing to do with prevalence of psychiatric illness. But we do ask marital history not for prevalence, but for prognosis. Prognostically, psychiatric illness have a better prognosis in married. Yes, we do ask marital history for prognosis. Occupational history, do we need to ask? Yes. Stress. Because job stress predisposes to psychiatric illness. That's why all over the world, people most prone to psychiatric illness because of their job are medical health professional, doctors. Doctors are the people because of their job who are most suffering from mental illness. Academic history. Do you think performance in the school matters to a psychiatrist? Yes, it is. So the answer of a question is food preferences. We don't ask food preferences. Which burger you like, which pizza you like. But academic history is worthy of a discussion. We will discuss it as a case. Let me discuss this first, then I shall write and you can copy. Decline in scholastic performance. Do you think it is important? Yes, it is. Mother of a 9-year-old child comes to me with the chief complaints of my child was having good marks in school in class 3. His marks started falling when he entered class 4. His marks started falling further when he entered class 5. Do you understand the history? The boy had 90% marks in 3, 70% in 4 and 50% in 5. So he's gradually losing marks in school. But he's studying. So when he's losing marks in school but he's studying, don't you think you would like to test something of this boy? What do you think is the first diagnosis that you'll think of? He's studying but not grasping, studying but not understanding, studying but not able to grasp, memorize, reproduce. Don't you think you would like to test his IQ levels? Absolutely correct. IQ levels. Why do we test IQ? Because IQ, intelligence quotient. If the IQ is low, the child cannot grasp, cannot retain. Low IQ is known as mental retardation. The normal human IQ is 90 to 110. Low IQ below 70 is known as mental retardation. When the IQ is low, the child cannot perform. And when the child cannot perform, the most probable diagnosis is low IQ. So first thing we test is IQ. If the IQ is low, the child is diagnosed with mental retardation and the child has my sympathy. No treatment is available of mental retardation since it's a neurodevelopmental problem. But is it possible that I tested the IQ of this child with low performance and the IQ comes normal? Yes. Name the condition in which the child performs poor but the IQ is normal. What is the condition? ADHD. Attention deficit hyperactivity disorder. ADHD. Why does this child has poor performance? Due to poor attention. Because he cannot be attentive, so he can't concentrate. So no attention leads to no concentration. So no retention in the class. No retention, so can't reproduce. Can't reproduce, so can't answer. Can't answer, so poor performance. Let's write this case. So the case is decline in scholastic performance. What is the test to be done? IQ test. IQ can be below 70 or IQ can be normal. Below 70 is known as mental retardation. Mental retardation is the most common cause of performance decline in children. But nowadays we don't call it as mental retardation. This has been given a new name asked in NEET 2018, intellectual disability. Intellectual disability. In normal IQ, the condition name is ADHD. Attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder. So below 70 is called MR. 90 to 110 is called normal. So what is 70 to 90 known as? 70 to 79 is known as borderline and 80 to 89 is known as dull normal intelligence. 80 to 89 is known as dull normal intelligence. If the child has low IQ, obviously his performance would be low. But if the child has normal IQ, then the reason of low performance is not low IQ, is poor attention. Because the reason being poor attention leads to poor concentration. If you can't be attentive, you can't be concentrating in the class. And if you can't be concentrating in the class, you cannot memorize. And if you cannot memorize, obviously you are going to have poor performance. Low attention leads to low concentration, leads to low memory, leads to low performance. Like mental retardation is defined as IQ less than 70. There must be something called as mild MR, moderate MR, severe MR, profound MR. Mild MR is IQ 50 to 69. Moderate is IQ 35 to 49. Severe is 20 to 34. And profound is less than 20. Mild MR, moderate MR, severe MR, and profound MR. Mild MR, moderate MR, severe MR, and profound MR. How do we calculate IQ? IQ is calculated by a formula mental age upon chronological age multiplied by 100. But there's a rule. In this formula, chronological age maximum can be taken as 15. The reason being, when you grow up, your IQ increases and attains a ceiling age at the age of 15. After 15, the IQ doesn't increase. So if in a numerical they give you mental age 10, chronological age 12, you take actual, that is 10 by 12. But if they give you mental age 10 and chronological age 20, you don't take 20, rather you calculate 10 by 50. Do you understand this? Suppose they give you calculate IQ of a child Ram whose mental age is 10, chronological age is 12. What should be the answer? 10 by 12 into 100. What is this? Approximately 83 something. But suppose they tell you to calculate IQ of Ram, don't calculate mental age 10 and chronological age 20. Calculate 10 by 15. IQ approximately 66. Don't do the mistake of calculating 10 by 20. After 15, the denominator should not be taken as actual denominator, should be taken as 15, because your IQ can't increase beyond 15 years of age. Am I clear? Let me give you one more example. Mental age 12, chronological age 20. Calculate IQ. Mental age 12, chronological age 20. So the options are 66.67, 80, 60, none. What's your answer? Mental age 12, chronological age 20. What's your answer? Will you calculate 12 by 20? Will you calculate 12 by 15? You will calculate 12 by 15 and the answer would be 80. Is that clear? So IQ can't increase beyond 15. That's why I tell students many times they say, sir, I believe I have low intelligence. I said, why? Sir, my friend reads once and he remembers everything. I read 3 times and I don't remember. Is he more intelligent than me? You must have felt in your life that this and this boy or girl is more intelligent than you. In your school days, in your MBBS days, he works less but he remembers better. Is he more intelligent than me? Answer is no. If you check IQ levels of yours, him, all of you have normal IQ. Almost all the MBBS doctor have equal IQ, normal IQ. Because if you are below normal IQ, you can't even enter MBBS. And if you have above normal IQ, you might not commit a mistake of entering MBBS. Because people who have above normal IQ, they have many other profession to choose. Why to become doctors? So average IQ of doctor is more or less normal. So if your IQ is normal, still your performance is low, the chances are you have attention deficit. Now some students say, sir, how can I be attention deficit? ADHD is a disease of children. Who said so? It's not necessarily a disease of children. When ADHD become adults, they become ADD. Attention deficit disorder. The hyperactivity component becomes less, but the attention component remains. So if you have performance decline, there are chances that you have attention deficit. Many students have attention deficit. They can't focus in the class. They can't retain. They cannot concentrate. They cannot memorize, although they have good IQ. So even with good IQ, so these children also have normal IQ. And these children also have normal IQ. Despite all this, despite both, they have decreased performance. So as an adult, you can have normal IQ decreased performance. As a child, you can have normal IQ decreased performance. ADHD in children becomes ADD in adult. The hyperactivity component becomes less when you become adult. Do you understand this? As a child, ADHD becomes ADD in adulthood. So in adults, the chances of performance decline with normal IQ is due to attention deficit. Please remember, if you are also not able to focus, if you are also not able to concentrate, it is possible that you may be suffering from ADD, not ADHD. ADD, attention deficit disorder. ADD, attention deficit disorder. Do you get it? Do you get it? Similarly, there is one more condition with normal IQ and decreased performance. You might have seen a movie if you watch Hindi movies by Amir Khan, Tare Zameen Par. Specific learning disability. These children also have normal IQ but decreased performance. They are of 3 types. Reading difficulty, writing difficulty and calculation difficulty. Reading is known as dyslexia. Writing is known as dysgraphia, and calculation is known as dyscalculia. These children also have normal IQ but decreased performance. So they are also in the right side. So left side it is mental retardation and right side it is ADHD and SLD. Can you see? Decline in scholastic performance, IQ low, mental retardation. IQ normal, either ADHD or SLD. SLD is of three types: reading, writing, calculation. Reading difficulty. Dyslexia children can't read similar looking alphabets properly, like B, P, M, W. Dysgraphia make frequent spelling mistakes. And dyscalculia, can't do basic calculation. Can't do basic calculations properly. Got it? Got it? So these are also with normal IQ. So decline in scholastic performance can be normal IQ, can be decreased IQ. Decreased IQ, mental retardation, normal IQ, ADHD and SLD. ADHD in children become ADD in adults. Is that clear? I hope you have noted it all. If you have missed something, you can again, pause, replay. So this was our video on history taking. So this is the second video of the series. The first video was introduction. The second video is general psychiatry, part 1, history taking. Okay, so what we have discussed in this video: chapter 1, general psychiatry, history taking. History is the most important part in psychiatric diagnosis. The most important history is personal history. The question came in personal history. The psychiatric personal history include all except. Answer was food preference. We asked academic history, occupational history and marital history. Marital history not for prevalence but for prognosis. Occupational history, stress. Decline in scholastic performance. The questions have come on this. Decrease IQ, mental retardation now known as intellectual disability, normal IQ ADHD, in adults known as ADD. Low attention leads to low concentration, leads to low memory, leads to low performance. Mild, moderate, severe, profound MR. IQ is calculated mental age upon chronological age, but the actual age should be taken below 15. Above 15, the denominator should be taken maximum 15. I hope this topic is clear. The next topic is going to be mental status examination. Let's catch up in the next video. Thank you.